For the attitude, the person must display readiness in performing the procedure. Number 2, displays conscientious efforts to correct mistakes. Number 3, shows enthusiasm and interest in performing the procedure. Number 4, employs professionalism, reliability, and confidence in the procedure. Number 5, answers rational questions readily. For knowledge and skills, number 1, scene assessment. Ensure safety of the rescuer and the client.
This scene is crucial to ensure that the rescuer is not putting themselves or the client at risk while attempting to provide aid. By checking the environment and the scene, the rescuer can identify potential hazards that may further harm the victim or pose a risk to the rescuer, such as traffic, fire, or electrical hazards. It allows the rescuer to make informed decisions about how to proceed, such as whether it's safe to approach the patient or if additional help is needed to manage potential dangers. Scene assessment serves as fundamental step in CPR process, prioritizing safety and effective response.
Number 2, position yourself by kneeling on one side of the client at the shoulder or chest area of the client.
Allows for optimal access to access the client's responsiveness and perform necessary interventions while also maintaining stability and control.
Number 3, tap on the client's shoulders and ask, Hey, are you okay? Repeat this step 2 to 3 times. If a client is unresponsive, proceed to the next step.
Repeatedly tapping on the client's shoulder and asking if they're okay helps assess their responsiveness. If they don't respond after 2 to 3 attempts, it indicates the need for further action to ensure their safety.
Number 3. Call out to the crowd for assistance and ask others to call an ambulance or call 911. It is in order to activate emergency services.
Position the client correctly on his or her back on a flat, hard surface.
Rationale. Positioning the individual on their back on a flat, hard surface is a fundamental aspect of CPR that ensures effective chest compressions, maintains spinal integrity, facilitates airway management, and enhances rescuer stability. This approach maximizes the chances of successful resuscitation and increased chances of survival during cardiac arrest.
Next, check for client's breathing. Tilt the client's head back to open the airway. Listen for client breathing for up to 10 seconds. If there is not breathing, start chest compressions.
Rationale. Checking for clients' breathing and tilting their head back to open the airway is to ensure proper oxygenation and ventilation, particularly in situations where the client may be experiencing respiratory distress or cardiac arrest. By tilting the head back, you are helping to straighten the airway, which can prevent obstruction and allow air to flow more freely into the lungs.
Place the heel of the non-dominant hand at the center of the sternum. Place the heel of the dominant hand over the non-dominant hand. Center your weight over your hands.
Rationale. This technique optimizes the effectiveness of chest compressions during CPR by positioning the hands correctly over the sternum and centering the weight, which helps maintain adequate blood circulation and increases the likelihood of survival in cases of cardiac arrest.
Perform chest compressions. Push down on the client's chest with the heel of your hand up to a depth of 2 inches.
Rationale. By pushing down on the person's chest with the heel of your hand to a depth of 2 inches, you are helping to circulate blood throughout their body. This is crucial because during cardiac arrest, the heart is unable to pump blood effectively on its own. Chest compressions help to maintain some blood flow to the brain and other vital organs, which can prevent further damage and improve the chances of survival.
Then, ensure appropriate chest recoil of the patient by lifting your body weight of the client in between compressions.
Rationale. Proper chest recoil is crucial for effective CPR. When performing chest compression, it's important to fully release the pressure in the chest between each compression to allow the chest wall to return to its normal position. This allows the heart to refill with blood. This step helps maximize the effectiveness of the CPR process and increases the chances of restoring the client's circulation.
Give 30 chest compressions. Push hard and fast at approximately 2 compressions per second.
Rationale. 30 compressions help maintain effective circulation, ensuring vital organs receive oxygenated blood. Pushing hard and fast at the rate of approximately 2 compressions per second helps generate enough pressure to effectively pump blood throughout the body and ensure adequate chest recoil.
After 30 chest compressions, give 2 rescue breaths. Tilt the client's head gently and lift the chin up. Pinch the client's nose and seal your mouth over the client's mouth. Blow air steadily and firmly for 1 second, and observe for chest rise while blowing air.
Rationale. The head tilt, chin lift maneuver opens the airway, allowing effective air passage into the lungs. Tilting the head and lifting the chin helps ensure a proper seal between your mouth and the client's mouth when delivering breaths. Observing for chest rise during breaths confirm that air is entering the lungs.
Repeat the cycle of 30 chest compressions and 2 rescue breaths for 4 cycles, and check the client's pulse or whether the client has regained consciousness.
Pulse. Pulse.
The cycle of 30 chest compressions and 2 rescue breaths in CPR aims to maintain oxygen circulation and support vital organ function during cardiac arrest. Repeating the cycle for 4 rounds helps sustain the person's chances of survival until the professional medical assistance arrives. While checking for pulse or sign of consciousness guides the next steps in care.
If the client remains without a pulse or is still unconscious, continue CPR until help arrives or the client recovers. Present pulse or regains consciousness.
Continuing CPR when a patient remains without a pulse or unconscious is vital because it helps maintain blood flow to the brain and other essential organs. This increases the likelihood of survival and decreases the risk of permanent damage to the organs while waiting for further medical assistance to arrive or until the client shows signs of recovery.
Place the client who has regained consciousness into recovery position. Raise the arm of the client that is nearest you with the elbow bent and the palm facing upward.
Placing the client in a recovered position helps to maintain an open airway. It prevents the tongue from falling back and obstructing the airway, which could occur if the person were lying flat on their back. It also prevents aspiration if the person vomits by allowing fluids drain out of the mouth instead of pooling in the throat, which could lead to choking.
Place the client who has regained consciousness into recovery position. Raise the arm of the client that is nearest you with the elbow bent and the palm facing upward.
The arm across chest helps maintain the client's stability and prevents them from rolling back into an unsafe position. Placing the back of the hand on the client's cheek and the rescuer's side provides support to keep the client's head turned to the side, which helps maintain an open airway and prevents potential obstruction. Flexing the knee on the other side and keeping the foot flat on the surface further stabilizes the client, preventing excessive movement and maintaining the desired position.
Lastly, with your hand supporting the client's hand on the cheek and the client's flexed knee, roll then the client toward you and adjust the client's chin to make sure the airway is open.
With your hand supporting the client's hand on the cheek and client's flexed knee roll, then client towards you and adjust the client's chin to make sure the airway is open. The purpose of this procedure is to assess and maintain the patient's airway. Ensuring an open airway is a critical first step in providing emergency medical care, as it allows the patient to breathe effectively. Supporting the patient's hand on their cheek with your hand helps stabilize the head and neck in a neutral position. Flexing the patient's knee and rolling them towards you helps open the airway by moving the patient's body into the recovery position. This allows the tongue to fall forward, preventing it from obstructing the airway. Tilting the chin up slightly helps further open the airway by lifting the tongue away from the back of the throat. This procedure is designed to quickly and effectively assess the patient's airway and take steps to maintain it. An open airway is essential for ensuring the patient can breathe properly and receive adequate oxygen. Performing the steps correctly can help prevent airway obstruction and respiratory distress in an emergency situation.